So let me introduce myself. My name is Dr. Benjamin Shultz. Now what I do here is I am the founder of Pittsburgh East Health Center, which is a multidisciplinary practice here in Monroeville, Pennsylvania, where we specialize in treating injured patients. What we've done is we've taken the specialty of chiropractic, rehabilitation, we've done medical injections, durable medical equipment, and specialty injections, and help patients who are involved in auto accidents, personal injury, and work-related accidents. Now what we found is over the years that patients would come in and they would come to see us not even related to their auto or work-related injury, but they would come in and we'll say it would be a 35-year-old female with 2 children would show up to the office with numbness and tingling down their extremity. They would come in saying, my neck is killing me, doc, you gotta help me, my hand is tingling, I've been running around trying to take care of my kids and now I'm not enjoying being able to be with my children because I can't think straight because of the pain that I'm in. They would go to their PCP, they would get some muscle relaxers, they would get some type of anti-inflammatory. They do these things and notice that it's giving them limited results. So these patients would come in asking for treatment because we would advertise that we help patients with disc pain. And they would say, I definitely have a disc. I would say, how did you injure this disc? They said, I don't know, doc, I'm just busy, living life, I'm a very active person. I'd say, well, what happened? I mean, this doesn't just happen overnight. You would have remembered having an injury. And they'd say, well, I really never injured my neck except for that car accident. And this is when I started noticing people were having these injuries, but never really reporting them. So what we found was you have to report these injuries. If you don't, what happens is later down the road, guess what? You're not able to open these cases, you're not able to notify these carriers of any injuries because they don't care. After a couple of years, you basically had a gap in treatment and you didn't do anything about it when it first happened, so it must not be there. So what we've done is we've taken these patients and we've kind of found that, okay, we know how to codify this. We know how to use the ICD-10 codes to validate what they have going on. And we've learned the process where basically when you learn about Colossus, Lemonade Inc., Health IQ, these are all ways that the insurance companies validate whether or not you have a serious injury and you meet the serious injury threshold. And so what we have to do is find out what injuries are there, because most patients go and they see the emergency room and they're diagnosed with a soft tissue injury or whiplash. And so what happens is that translates into a sprain strain, which basically isn't very inclusive of all the things that are going on, especially with a person who has a disc injury, who has a posterior longitudinal ligament injury, they have ligament instability, they have radiculitis, they have all these different things happening, but wasn't documented or even verified. So what we've done is we put in different professionals. So what we've done, we have mid-levels, PAs, nurse practitioners, we have a DO, we have a chiro, DC. So what we do is we put together all these different professions to actually get the patients better faster, document it, and then validate the treatment. And what that means is once a patient has a treatment plan, and once a patient has gotten imaging or an NCV, or they've been treated and we know what's going on with them, we get the patient to a certain status where we can say, okay, this is what the injury was, and we know that within an amount of certainty that this patient has this much permanent impairment, and we have 3 different providers sign off that that's what's going on with the patient, and we can validate it. Medical validations where we have these providers ensure that this is what's going on with the patient, so when these are submitted to the insurance company, they can't refute it. And so I just want to make sure that you guys know what we do, why we do it, and where this is going to be a value in the future.